COVID rates are up sharply once again, and nowhere are they higher than Dundee. The city is Scotland's hotspot, a nation where 1 in 100 people has the virus, according to new data from the Office for National Statistics.
We've already had a delay in the easing of restrictions in Scotland in recent months. And in fact, that's been local in Glasgow and then national applied to other areas. So the next big date for us, of course, is also July the 19th to level 0, which still some restrictions, but far fewer. And the Scottish Government is not ruling anything out.
The Delta variant is driving the rise, but it's the easing of restrictions that's letting it loose. And it's the same across the UK.
Let's look at the latest numbers. The R number, a measure of how fast the virus is spreading, is now between 1.2 and 1.5, up slightly from last week. And new ONS figures show what that means for cases. More than 400,000 people are estimated to have been infected in the week up to July the 3rd. That's a rise of 56% on the previous week. And just look at how the third wave has picked up speed. At the start of June, the weekly rise in cases was just 7%. Scotland's high rate of 1 in 100 people being infected was followed by England, where 1 in 160 had the virus. In Northern Ireland, it was 1 in 300, and in Wales, just 1 in 340. Within England, the North East is now the hotspot, with 1 in 69 people infected, overtaking the North West. Elsewhere, infection rates are rising much more slowly, with the lowest rates in the east of England, with around 1 in 300 infected. Hospital admissions and deaths aren't rising as fast in this wave, thanks to the vaccine. But new data from Public Health England is concerning. It looked at 257 people known to have died with the Delta variant. 92 were unvaccinated, but 118 had had both doses. That's because the vaccine is good, but not perfect. The overwhelming majority of deaths were people aged 50 or older, reflecting the strong age-related risk of COVID. It's what you would expect, but it shows that even if you've had your jabs, you're still at small risk, and deaths are likely to rise as cases surge from the rapid rollback of lockdown.